Welcome, I'm Austin Shepard and President and CEO of Fiduciary Trust. And today we're going to talk about Alzheimer's and dealing with the financial ramifications of it. Today I'm joined by Jody King, our Director of Client Services, and also Dr. Lisa Genova, Harvard-educated neuroscientist and also the author of the best-selling book, Still Alice. I'd like to open up this conversation with one fact that I know that both of you know, which is that 5.3 million families today, as a family unit, are dealing with someone who has Alzheimer's. And so, Jody, I'd be interested to hear your thoughts about maybe best practices of dealing with this realization from a financial context.
Yeah, thank you, Austin. We found that it's useful for a family to kind of look at we're bringing 4 stages of planning around a diagnosis of Alzheimer's. The first stage is one, they need to recognize the condition, which sometimes that's really hard to do and can be emotionally very draining to actually come to terms with what is coming down the pipe to them. The second step is to develop a care plan. And with the care plan, it's really articulating the individual's wishes and how they want to be cared for and who's going to care for them as their cognitive abilities change. At this point, it's also important to gather and organize the financial information the individual has while they're still able to assist with that. And finally, it's also very, very important to review legal documents and name fiduciaries to make sure that the right parties are named and the documents are providing the right directions so that their wishes can be cared for, they can be cared for, and their wishes can be taken care of as they move along through the disease. And they need to move quickly as they do this, because with Alzheimer's and other dementia, as their condition worsens, they won't be able to make those decisions both legally and also just articulate them. So it's important to act quickly.
Thank you, Jody. That's the framework that you outlined, the 4 steps, I think is very helpful. I'm curious to hear, Lisa, with your experience in this area, your own sort of macro perspectives about how families address this and deal with this situation.
Yeah, it's been really tough. There's this conception that forgetting is a normal part of normal aging. And so with that idea in mind, families let this disease sort of go along a little too far. Nana's just getting old. Mm-hmm. And there's also a denial, a real psychological denial that goes on with everyone in the family because no one wants to see this happen to someone you love. So typically diagnosis happens kind of well into the disease progression. Mm-hmm. And so you end up wrestling with, you're not dealing with someone at the very earliest stages of the disease when families are getting together trying to figure out what to do. And it's also really tough. Neurologists will tell patients and families who get this diagnosis that this can take anywhere from 2 to 20 years to see it all the way through, and there's no way of predicting which way it's going to go. And so that's a really tough thing for families to wrap their hearts and minds around. How do you plan emotionally and financially for 2 or 20 years? So they really do need a lot of help.
A very complex question with a lot of different components. And over the next 3 segments of this video, we'll go through not only the planning approach, but also the human aspect of this.